This month's in-service is about the consistent carbohydrate diet. The consistent carbohydrate diet is used to help control blood glucose levels. It provides a consistent amount of carbohydrate and makes sure there's not too much carbohydrate given at each meal to help the patient's blood glucose levels stay stable and help their medications work properly. My plate, which you may have seen, shows us the different food groups that patients need for a healthy, balanced diet. There's the fruit group, the grain group, vegetables, protein, and dairy. The food groups that contain carbohydrates are fruits, grains, dairy, and vegetables. The protein category does not necessarily contain carbohydrate. The protein group contains meat, fish, poultry, eggs, and nuts, and all of those have very minimal carbohydrate. A patient that needs a consistent carbohydrate diet has a little bit more detail to learn about the MyPlate to help them. For example, the dairy group, which has milk, yogurt, ice cream, cheese, and cottage cheese in it, milk, yogurt, and ice cream have about 15 grams of carbohydrate per serving, but cottage cheese and other cheeses only have 0 to 5 grams of carbohydrate per serving. So patients need to learn that not all dairy counts as carbohydrates, just some of them. And then there are some considerations in the protein group. For example, dried beans like kidney beans are technically in the protein group, but they also contain carbohydrates. So a fourth a cup of cooked kidney beans has 10 grams of carbohydrate. So patients meet with a dietitian and learn about these different caveats of the food groups and which have carbohydrates and which don't. At Faulkner, we have different diet orders that range from 45 grams of carbohydrate per meal up to 90 grams of carbohydrate per meal. So depending on their diet order, they will get sort of a budget of carbohydrate to use at each meal. Foods that are high in carbohydrates or sugar are allowed on the diet, but will take away from other foods. So for example, if the patient wants lemonade, that's going to take 28 grams of their carbohydrate at that meal, versus a lemon vitamin water zero will be 0 grams of carbs. So if they could have the lemonade, but if they want to have more food, they should probably switch to the vitamin water zero. Mashed potatoes have 16 grams of carb per serving, whereas broccoli only has 2 grams. Strawberry layer cake has 19 grams of carb, whereas the diet chocolate mousse only has 5. So by substituting different things like that, they can actually get more food, or if they are really adamant that they want the strawberry layer cake, they may have to give up a different item on that tray to make it fit within the diet order. Health Touch has a hard maximum set for carbohydrates at each meal. So this means that when you have added all of the food to the tray and you've hit the carbohydrate maximum, you cannot add any more items to that tray. And it'll be important to help the patient find lower carbohydrate alternatives so that they can get a good balanced meal. And there are some other tricks you can use, like giving half portions of certain high carbohydrate items to fit into the meal. One thought though is be sure to be thoughtful when you're having items. For example, the tray line can't really half an ice cream, so don't choose to half an ice cream, but you could half mashed potatoes. And the other thing is, please only use half portions. Don't do like 0.25 or 0.66 or anything like that, because the tray line, it's really hard for them to portion that out. Here we have a patient who has ordered lemon sage chicken, roasted sweet potato, broccoli, carrots, and diet cranberry juice for dinner. Now the patient is really looking for a dessert and really wants the vanilla pudding. When we click on the vanilla pudding, however, it's going to be too much carbohydrate. We have to stick to the 45 to 50 grams per meal, and that would give us 57 grams. So there's a couple of options here. We could either offer the patient the diet vanilla pudding, which would keep them well within the carb budget for the meal, or we could do half of the vanilla pudding. So we have to find the half button first and click vanilla pudding, and then that would also keep them within the 45. Speaking of the 45 gram per meal consistent carbohydrate diet, you are going to start to see this diet ordered more and more. And the reason is the orthopedic surgeons at Faulkner have done a study and found that patient blood glucose levels do better after surgery when they're on this lower carbohydrate diet. So they are going to start ordering this diet for all of their post-op patients. So you're going to start to see a lot of patients on 7 South and maybe even 7 North getting on the consistent carb 45 gram per meal diet. So it's important to become familiar with this diet and learn some strategies to help the patient swap out different things so that they can stick to the 45 grams per meal. The patients will be told that they're going to be on this diet for their health and to help with their recovery. And they're also going to receive a little admission packet that will explain about the diet and also give a little handout about a sample diet. So this is the example of the sample diet that they will see in their admission packet. And I want to show you a little trick of the trade. I've programmed the sample menu that's in their admission packet for the breakfast, lunch, and dinner buttons on the 45 gram per meal diet. So if they said to you, oh, just give me the standard meal or the sample meal that's in my menu packet, you could just click on lunch. And it will print out exactly what they should get on that meal. And one more thing to show you, I've also programmed this CCD snack. This can be used for the 45 gram per meal patients. It can also be used for patients on other diets that are still hungry but have maxed out their carbohydrate for the meal. When you click it, it's a string cheese, carrot sticks, and celery sticks, which is virtually 0 carbohydrates. So it's a nice little snack for them, but it's not contributing any more carbohydrate to their diet. Some final considerations for patients that are on the consistent carbohydrate diet. Since physicians are using this diet now for a variety of patients, not necessarily patients that have diabetes, but patients that need to heal from surgery or for other reasons, it's important not to tell the patients you are on a diabetic diet when you see them on consistent carbohydrate, because they may not in fact have diabetes and you might be scaring them. Instead, you can say you're on a consistent carbohydrate diet and I can help you order a meal that meets your carbohydrate target. And one other consideration, I don't have anything programmed in for the per day amounts for carbohydrate. So as long as you stick to those per meal amounts, you'll be within the target. You don't have to worry about what it's saying for the daily carbohydrates in Health Touch.